Well, now, as the world commemorates World AIDS Day today, we trace the evolution of the HIV epidemic in South Africa. HIV/AIDS have taken a devastating toll in the country, especially during the early days of its discovery and the subsequent government response. It is believed that if the country had found a clear, sustained national intervention, it could dramatically have altered the course of the pandemic. We now talk to former Deputy Chairperson of the South African National AIDS Council, Mark Heywood. Now, Mark has been at the forefront of activism on matters related to HIV and AIDS from the time he joined the AIDS Law Project in 1994, becoming its head in 1997 and executive director in 2006. Also, the chairperson of the UNAIDS Reference Group on HIV, AIDS and human rights between 2006 and 2012. I don't think there's anyone better to speak to on this day, Mark, and it's wonderful to have you. Thanks for your time.
Good morning, Leanne, and thank you for focusing on this important issue on this important day.
Yeah, I worry that we're not focusing on it enough because, looking at the latest statistics, it's still a very, very bad situation for South Africa. Do you think that I'm going to talk to the history and the evolution of HIV and AIDS, but do you think we've almost forgotten, in a way, the fight against HIV and AIDS? Of course, everything is being dominated by COVID right now.
Leanne, I think there is a real danger that we've forgotten the fight against HIV and AIDS. This year has been the highest number of deaths because of COVID and HIV combined since the early 2000s, when we were in the worst moments of the AIDS epidemic. We know that because COVID has become the sole focus of our attention, HIV testing has dropped. People have been enrolled onto antiretroviral treatment slower than in the years before. And the HIV epidemic hasn't gone away. I mean, let's just remind ourselves of the statistics. Close to 8 million people live with HIV in South Africa alone. We are still the epicenter of the world's HIV epidemic. We have 5 million people on antiretroviral treatment, which is a huge achievement, and perhaps you will come to that. But there are also 3 million people who should be on antiretroviral treatment and whose health would get better and whose risk of death would diminish, who are not on antiretroviral treatment. So we need to be campaigning around HIV prevention and treatment with the same vigor that we have done in the past. And COVID should not be seen as something that is running some sort of parallel course to HIV. We need to see that there is a potentially deadly connection between COVID and HIV. We now know that people with HIV who are not on treatment are more likely to die of COVID, for example. But we also know that all people, for whatever reason, whose immune systems are weak and are suppressed, are candidates for developing mutations of COVID and COVID variants. So HIV and COVID are coming together very dramatically, I believe, and require us to, just as we have to step up our vaccination campaign, we need to step up our AIDS treatment enrollment campaign.
Yeah, indeed. I mean, in your answer, you're mentioning that, obviously we've come a far way. Take us back to the early days, Mark, because, my mind goes back to so many things, the treatment, the denials, the spinach and garlic and the world looking at us in shame. But obviously you being at the forefront of it all, looking at how far we've travelled, perhaps you can take us on a quite a summarised version of where we were and where we are.
Well, as you say, it's been a very long journey. And as you also said in your introduction, the sad thing about HIV in South Africa was really we probably missed nearly 20 years where we should have been much more focused, much more urgent in dealing with this epidemic, the first 20 years. Leanne, the first cases of HIV were picked up in South Africa in the middle of the 1980s. In fact, it's the 40th anniversary of the detection of HIV this year. And the first cases in South Africa came in, I think, around 1983. Unfortunate for us, the start of the HIV epidemic coincided with our efforts to build a democratic society, the end of the 1980s, the beginning of the 1990s. And so a lot of the focus was justifiably elsewhere. And it was mixed with a conservatism. People didn't want to talk about HIV because it involved sex, because it involved sex work, because it involved gay men. And really, activism around HIV only started in the late 1980s with people like Edwin Cameron, Zaki Ahmad, the AIDS Law Project, the AIDS Consortium. The Treatment Action Campaign was formed in December 1998. In fact, the anniversary of TAC is in a few days' time. But then, as you've hinted at, just as society was mobilizing to take the epidemic seriously, we entered into a period of what we call AIDS denialism, where President Mbeki, the former Minister of Health, Mantu Shabalala Msimang, were suggesting that there was no such thing as HIV, that it was a conspiracy of pharmaceutical companies, that the drug companies were just marketing antiretroviral drugs to make profits. And probably for 6 or 7 years, there was immense confusion. There's a parallel at the moment in the anti-vaccination campaign, which is anti-science, which seeks to misrepresent science. But at the point when HIV was spreading most quickly in our communities, it had been politicized and caused confusion. So I date the point at which we really began to take HIV seriously from the middle of 2000s, really 2006, 2007. And then when we found a common purpose as a country in late 2006, we proved again that South Africa is capable of miracles. We went from a country that was a pariah, that had nobody on antiretroviral treatment, within 5 years to a country with nearly 5 million people on antiretroviral treatment, the biggest program in the world. We prevented 5 million deaths. And so for me, the HIV story, as much as there were difficulties in the early years, is a story of hope and a story about our power when we work together with a common purpose. And let me pause there, because what has happened under COVID, of course, is another chapter, if you like, of our HIV response.
And that's where I do want to come in, because the story is an amazing story in terms of the treatment, and so many South Africans having their lives saved and being on antiretrovirals. But I want to talk to still the lack of behavioral change, because it's, even though there is treatment, the infection rate is still high, and you wonder about the education campaigns that, in terms of how you can avoid getting HIV and AIDS. But that's something I'm going to talk to. But you ended off on a very important note, and that is how COVID has actually hampered the fight, because we saw that a lot of resources were actually taken away from trying to assist people with TB, trying to assist people with HIV, and moved towards COVID. How detrimental has that been? Because when we were in hard lockdowns and people couldn't go anywhere and people were scared to go to hospitals and get their treatment, I can only imagine that this has taken us back years in terms of the fight, or perhaps it didn't.
No, it did. It definitely did. It has certainly been detrimental. It's hardly to say how detrimental it's been yet, because in a sense the data has still got to come through. But you will remember that, in the middle of the hard lockdown, there were reports of thousands of people, I think something like 12,000 people just in Gauteng alone, not coming to pick up their antiretroviral treatment. That problem will have continued. There's a probability that many people may have defaulted on treatment, increasing drug resistance, increasing their illness. I've heard stories from some of the people I work with today that in parts of the Eastern Cape, clinics and hospitals are beginning to see, again, AIDS-defining diseases that they haven't seen for quite a number of years. I heard from Dr. Glenda Gray at the Medical Research Council that the Sisonke study, which is testing the COVID vaccine on healthcare workers, has found something like 40,000 healthcare workers who live with HIV, many of whom are not on treatment and have very weak immune systems. So we can't quantify it yet, but we have enough information to say that this is a very real danger, and that this recession, if you like, of information and advocacy and organization around the HIV epidemic has to end very, very quickly. We have to put HIV back on the agenda, as you say, not just as a treatment issue, but as a prevention issue, because also when people stop taking treatment, they become more infectious. We know that treatment works as prevention. So these really are the questions that we should be grappling with. COVID is critically important, but HIV remains a huge challenge to our society.
It certainly does, and the big issue is that we've seen testing drop as well. So people may have it, but they don't know because they've stopped testing. I mean, I'm seeing numbers of around about a 23% drop in HIV and AIDS testing. Also talking to millions that were done the previous year. This was in 2020, but have suddenly stopped, and people just don't know they've got it, and then the spread starts all over again. This is also a behavioral issue that we need to worry about. So as much as we do have a lot of the ARVs that are available and people can lead very normal lives, but the youth being affected predominantly is a great worry, and particularly young girls, because that's something we need to focus on. Where are we losing the plot in terms of educating people about how detrimental this is to you?
Well, Leanne, you're absolutely right. I mean, you've said it all and I won't repeat it. Condom use, safer sex, understanding sexually transmitted diseases and how to prevent sexually transmitted diseases is critical. I mean, you have to ask yourself, when did you last see on the SABC or in any other media messages about condom use, about safer sex? I haven't seen anything for a very, very long time. And yet, as I said at the beginning of this interview, we have 8 million people living with HIV in this country, and most of those people have sex. And so, people on treatment don't pose significant risk of onward transmission, but 3 million people who are not on treatment do. So those messages are critical. But Leanne, one thing I would say is that I think what we're learning now is we have to stop teaching health in silos. HIV is a threat to our society. COVID is a threat to us. Let's not say our society, it suggests it's someone else. HIV is a threat to me and you. It's a threat. COVID is a threat to me and you and everybody who's listening. What we eat, the types of foods that we eat, the alcohol that we consume in ridiculous amounts, many of us, is a threat. We need a holistic campaign that helps people to understand all the dimensions of health and what we can do to protect our health and what government can do to regulate and control the things that threaten our health in different ways. If we don't embark on that, Leanne, we are in deep trouble. South Africa is probably the most unhealthy country in the world. And I'm not exaggerating when I say that. There isn't time to explain what I mean by that, but we face multiple health threats, and it is in our hands, assisted by our governments, to try to contain that, because health is central to all of our life. It's central to our education. It's central to our opportunity. It's central to our work, and it becomes central to the political issues we face in this country, particularly how we become a fair and equal country in the years ahead.
Yeah, and I mean, we can never ever put it away from the fact that HIV and AIDS is still the biggest killer on the continent and in South Africa. As much as we know that there have been a lot of excess deaths when it comes to COVID, HIV and AIDS is there, and very, very much so still, in terms of taking lives. And this is something we need to completely emphasize. I just want to talk about the cure. I'm just looking at the time. We've only got like a minute or two. Finding a cure for HIV and AIDS is still very, very elusive. In December 2020, Lancet published a paper on the effectiveness of pre-exposure prophylaxis, saying it has proven to be a highly effective and safe way to prevent HIV infection for HIV-negative people if adhered to. Would you say this is groundbreaking preventative methods available? And where are we in terms of trying to get a cure for AIDS?
Sure. In 1 minute,
Sorry.
Let me try. The first thing I would say, Leanne, is we're still searching for an AIDS HIV vaccine. It has proved very, very difficult. That is one line of research journey inquiry, and for anti-vaxxers who point to the quickness of the COVID-19 vaccine as some sort of conspiracy. They just need to look at HIV to see that, in fact, this is a very, very difficult endeavor. If there was a big profit to be made, it would be out of an AIDS vaccine. But nobody has cobbled together science to say, here, we have a vaccine, now we can make lots of money. So celebrate and take advantage of the COVID-19 vaccine, because these things are not easily achieved. As far as treatment, though, and treatment as prevention, as you mentioned, we have made huge breakthroughs that transformed HIV. You talk about pre-exposure prophylaxis. It's not new. We've had it for over a decade. You can have pre-exposure prophylaxis, which means taking antiretrovirals if you are engaged in risky sexual relationships. It reduces your risk of infection. Post-exposure prophylaxis for people who take antiretrovirals after they've been raped, or if they've been in a risky sexual encounter, or for mothers as part of prevention of mother-to-child HIV transmission. Leanne, the message is really, when it comes to treatment and its benefits for prevention, we have a whole armory. And we need to use that armory effectively.
Indeed. And I have to leave it there. But I've got to bring you back for the long answer. That was the short one. Thank you so much. Mark Heywood, always a pleasure speaking to you. And thank you for your tireless work on HIV/AIDS. And that's where we've got to leave it, unfortunately, for the SABC2 viewers. We have another hour coming your way, though, on Channel 404. Sakina?
Yeah, that's it for